Welcome. I'm your host, Neil Howard, here on Health Professional Radio. In this segment, we're going to be speaking with Cathy Kuhn. She's joining us here from Updox, the only place to manage healthcare communications across both in-person and virtual care. Updox offers one consolidated inbox for healthcare providers to manage the entire patient journey and offers productivity. Welcome to Health Professional Radio. Cathy, how are you this morning?
Good. Thanks for having me.
Give our listeners a bit of your background, talk a little bit about your area of expertise, and then fill us in on Updox's mission and your specific role at the company as well, if you would, briefly.
Sure. Well, I'll start by just telling the listeners who I am. So my name's Cathy. I'm a pharmacist by background. So what brings me to Updox is really my passion with connecting community providers and just the work that community providers, whether it be physicians, pharmacists, and just other type of healthcare providers, the way that they connect to patients and make impact on the outcomes that they have. So prior to coming to Updox, I did have experience with community pharmacy, working for a number of community pharmacy chains, implementing clinical services. And then I also spent time with an accountable care organization, and there I worked side by side with community pediatricians as well as health plans to help enter the role into value-based care. So what really excited me to come to Updox is that the idea of innovation and the way that technology can help, again, continue to help community providers provide the best care that they can for their patients. Just to tell you a little bit more about Updox. Updox is a healthcare technology company. We're located in Dublin, Ohio, and we have over 470,000 users, 170 million patients across the U.S., and we're integrated with more than 100 EHRs and pharmacy management systems. What's really cool is that we have a very broad set of capabilities for patients, which include patient engagement, provider communications, and internal productivity. So one of the biggest things that we know with COVID-19 was just the boom with telehealth and just the overall trust in technology and understanding and need of technology to help grow the healthcare business. So specifically, my role at Updox is that I serve as a voice of the clinician. So I provide clinical insight into product development and then provide thought leadership and use cases on how Updox solutions work easily and well with healthcare practices.
You know, you talked a little bit about trust there in your statement. During this pandemic, have you seen more trust in the pharmacist as opposed to the clinician? Has the trust in the pharmacist been elevated, especially during this virtual care period that we find ourselves in?
Absolutely. So I think we very soon found out that pharmacists are essential healthcare workers. You know, I've known that and believed that all along, being a pharmacist, but I think the public truly recognized that, knowing that pharmacies remained open during the pandemic. You know, pharmacists were the most accessible healthcare provider because they were there in your community at the grocery store, providing the medications and just the education that you need about your health. But just even furthermore, you know, there's a lot of restrictions that were, removed because people recognize the way that pharmacists can make impact. So immunizations recently, age restrictions around immunizations that pharmacists could provide had gone down to age 3. Previously, depending on state, it was age 7 or even just adults. So it was really great that pharmacists were able to have that opportunity to continue to provide care for patients, especially during this type of public health emergency. And then furthermore, pharmacists were able to help with COVID-19 testing, which we know is so important for what's going on. And just even more in the future, we'll see COVID-19 immunizations be important once the vaccine becomes available. And again, just pharmacists being so accessible and knowledgeable, they'll be positioned to make an incredible impact to the communities.
You know, when talking about that impact as a consumer and not a healthcare professional, even if I was talking to a healthcare provider on the phone, for whatever reason. I knew that when it came to the pharmacist, I was going to have some face-to-face interaction and get that expertise face-to-face. In this new virtual world, how has the pharmacological industry dealing with caring for patients virtually?
Sure. So pharmacies have remained open. But I think with the virtual world happening, it opened up new opportunities for pharmacists to connect with patients. It also afforded just new efficiencies within the pharmacy so that pharmacists really can step out from behind the counter and spend more time with patients. So if we think about telehealth, obviously that opened up a new way for pharmacists to connect with patients. But if you ever call a pharmacy, it can be hard to get through. I think right now nobody really likes spending time on the phone. Everybody prefers text. And so text has just been a great option pharmacies have also been able to provide to connect with patients.
Meds have always been front of mind for people suffering with any type of ailment. The financial cost of COVID-19 have gone across the board, even with transportation to and from the pharmacy. How have you seen your pharmacy patients affected by COVID-19 specifically?
Yeah, so I think not just specific to pharmacy, but across the world, healthcare has been impacted. So patients have not necessarily felt safe. And just because they wanted to be socially distant. So they oftentimes avoided care. But where I've seen pharmacies and other healthcare practices really flourish is when they actually embrace technology, because like I mentioned before, technology is just that great way to stay connected. Most people today have a smartphone, and patients are not wanting to avoid care. They're just feeling unsure, and they still want to connect to their trusted healthcare provider, and technology is a great way to do so.
You mentioned COVID-19 opening up some new opportunities. Let's talk a little bit about the pharmacy of the future. What do you see going forward based on some of these lessons that we're still learning?
Yeah. So, again, just not for pharmacy, I think for healthcare in general, we've been slow to embrace technology. If we think about fax machines, those really only exist in healthcare, and, who knows why, but that's something so archaic that we need to leave behind. So I think what we'll see for the future of pharmacy and healthcare practice is that now that we've experienced this pandemic and we realize the need for technology and the ways that it helps with different inefficiencies, I think pharmacists and pharmacies will be able to embrace that more. And like I said before, the more that they embrace things like technology and different roles that their partners can play, such as like technicians and student pharmacists, then the more the pharmacists can really, practice at the top of their license and be worried about more high value type services that they can provide to a patient versus something that, a technology like electronic fax, secure texting, that become more automated for just those, little communications that still need to occur, but in current reality is often time consuming and cumbersome to the actual practice.
Well, we'd like to learn some more about Updox. Where can we go online and get some more information about your company, its mission, and a little bit more about how it's impacting this COVID-19 pandemic overall?
Yeah, so we are available at updox.com. That's updox.com. We also have social media sites on LinkedIn, Twitter, Facebook. So really you can find us anywhere. And I'm personally on LinkedIn as well. So I'm always happy to connect with more healthcare providers and just learn ways that discuss ways technology can help enhance community and healthcare practice.
Well, I appreciate you joining us here on Health Professional Radio.
Yeah, thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Cathy Kuhn, pharmacist, director of strategy consulting at Updox. Audio copies of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.